Hello everyone, I'm Felicia Amumah from the University of Abuja, Nigeria. I want to thank the Food International Africa region for asking me to be part of the faculty for Diabetic Food Awareness Global Series. And my outline goes thus: Introduction, Diabetic Foot Disease, the Nigerian Diabetic Food Story, 6 illustrative cases, discussion, University of Abuja Teaching Hospital Diabetes Food Group, Diabetes Food Care/Podiatry Project, does food care education work, and then conclusion. Introduction. Diabetes mellitus is a group of metabolic disorders characterized by hyperglycemia. It is one of the greatest epidemic of the 21st century. Type 2 diabetes is a multi-hormonal cardiovascular disorder characterized mainly by insulin resistance and relentless loss of B cell function. Thus, the B cells become progressively less able to secrete sufficient insulin to maintain normal carbohydrate, protein, and lipid homeostasis. It is the fourth or fifth leading cause of death in most developed countries, epidemic in many developing countries now. The 40-59 age group has the greatest number of persons with diabetes, and the same age group has the greatest number of persons with pre-diabetes. In Nigeria, the pooled prevalence of diabetes as at 2018 was 5.77%. 1 in 10 people live with diabetes, and every 5 seconds, someone dies from diabetes-related cause. This slide shows the latest IDF estimated age standardized country prevalence of diabetes in adults 20 to 79 years. And we can see that Nigeria has less than 4%. And we think this is an underreporting from the situation that we have right now. And looking at this also from the International Diabetes Federation, the adult population worldwide having diabetes is 581 million, and this is projected to become 1.2 billion by 2050. And then when we look at the African region, the top 5 countries for number of people with diabetes: Nigeria 3.0 million people. Like I said in the previous slide, this is an underreporting because the systematic review and meta-analysis that was done from studies from various regions of Nigeria as at 2018 showed that we had 11 million people with diabetes. But luckily, a national survey for non-communicable diseases has been carried out recently and completed. Data is being analyzed now, and so we hope to get at least near true figures of the cases of diabetes in Nigeria from that national survey. This is the estimated number of deaths due to diabetes in adults by age and sex in 2024, and it is reported by the IDF that about 3.4 million adults have died because of diabetes or its complications in 2024. Diabetes is a leading cause of cardiovascular disease, kidney failure, blindness, and lower limb amputation. And we can see that 60% of non-traumatic lower limb amputations occur in diabetes patients 20 years and above. The diabetic foot. Diabetes and the foot in Nigeria. Diabetic foot disease. Diabetes mellitus is a silent disease until the onset of complications. The complication of diabetes with very high economic cost is the diabetic foot. 3 great pathologies come together in the diabetic foot: neuropathy, ischemia, and infection. Prevalence of DM foot in Nigeria is about 8.3% to 19%, and amputation rate could be as high as 53.2% in some centers. The lifetime risk of a person with diabetes developing DM foot ulcer is as high as 25%. 15 to 20% of patients with foot ulcer will subsequently require amputation. Greater than 1 million amputations are performed on people with diabetes per year. Every 30 seconds, a limb is lost to diabetes. 4 out of 5 ulcers in persons with diabetes are precipitated by trauma. One episode of DM foot ulcer is a risk factor for another ulcer. The socioeconomic factors responsible for diabetic foot. This slide was taken from Dr. Abbas et al. Barefoot walking, inappropriate footwear, lack of awareness, both in patients and in healthcare workers, podiatry services non-existent, home treatment, tendency of patients to see first faith healers, herbal doctors, and of course poor living conditions leading to overcrowding and then rodents and ride bites. The Nigerian diabetic food story. In Nigeria, diabetes care is being carried out at the primary, secondary, and tertiary levels of healthcare. In many of the centers, either there is no education at all about basic food care or it's provided too late. Many patients with food problems present to the tertiary health facilities at the stage where 50% of the time the only option is amputation. Diabetes food constitutes a major medical, social, economic, and psychological burden to the patient, the healthcare system, and the public in general. 6 illustrative cases of diabetic foot in Nigeria. Case 1. Mr. O.M., a 32-year-old male architect known diabetic for 8 years with poor drug compliance and poor clinic attendance. He had a right foot ulcer which started as a blister in his big toe for 1 month. He managed it at home and later presented to the emergency with multiple discharging sinuses on the foot. Had a waist circumference of 102 cm and BMI of 35. Case 2. Mr. SS, a 49-year-old male police officer known diabetic for 7 years. He presented with a 3-week history of right foot ulcer which started as a boil that later ulcerated after self-manipulation at home. Presented with DM foot ulcer, Wegener grade 3. Case 3. Mr. AE, a 60-year-old male engineer known diabetic for 22 years, hypertension 5 years. He presented with right foot ulcer for 2 months after a wire gauze pierced his leg at a building site. He had a BMI of 32 and Wegener grade 4 foot. Case 4. Mr. IK, a 45 years old custom officer known diabetic for 7 years, presented with a 3-month history of right foot ulcer. It started as a blister which progressively increased in size, resulting in Wegener grade 3 foot. There was a history of wearing of tight-fitting boots for 8 to 12 hours most days of the week because of his job. Case 5. Mrs. OV, a 67-year-old female retired teacher known diabetic for 7 years, hypertension 2 years. She had a 3-week history of darkish discoloration with blister formation on her left foot and leg. Had positive history of intermittent claudication on the left leg for 3 years. Presented with Wegener grade 5. Case 6. Mr. AM, a 57-year-old male civil servant, had diabetes for 12 years. He had lost the gift of pain, bought a new shoe which was tight, wore it the whole day, and suffered abrasions. Presented with grade 4 Wegener and severe sepsis. He died few days after hospitalization. Discussion. Diabetes is a silent disease until the onset of complications. Food care education is an integral part of the diabetes information package which must be communicated early. These 6 illustrative cases were educated people: an engineer, an architect, a police officer, a custom officer, a teacher, and a civil servant. But they were never informed by their healthcare providers of the possibility of developing diabetes-related changes in their feet, such as ulcer, gangrene, amputation, and even the possibility of death. The University of Abuja Teaching Hospital Diabetes Food Group. The University of Abuja Teaching Hospital Multidisciplinary Diabetes Food Group consists of the following specialists and of course led by the endocrinologist. In the University of Abuja Teaching Hospital Diabetes Center, we have a diabetic food assessment and treatment room, and this is a display of some of the equipment we use to assess the fit of our patients. And you can see my humble self and the authorities there trying to see how we can protect the feet of this patient so she does not come back to us with ulcers. This is assessment of protective sensation using monofilament in our patient. Plantar pressure measurement using the PODA scan, and we can see areas of pressure in this printout, and these areas of pressure need to be protected so the patient does not break down with ulcers. This is vibration perception threshold testing using neurotensiometer or biotensiometer. We are using the handheld Doppler here to check the vessels. And these are some of the offloading shoes and of course insoles for protection that we use for our patients. The Diabetes Food Care / Podiatry Nigeria project in collaboration with the World Diabetes Foundation. This was done between 2017 and 2019. And the aim of the project was to improve healthcare providers' capacity to offer quality food care education to persons with diabetes to prevent diabetic food. We also introduced podiatry to empower them with skills that will enable them adequately manage common diabetes food problems. We worked in 22 government health facilities in the Federal Capital Territory in Nigeria, and these are the names of the facilities where we worked in. This was at the beginning of the program. Professor Isaac Adewale was the Minister of Health then, and so he was there with Dr. Abbas, as we can see, for the opening ceremony for the program. And these are some of the participants for the program. We had faculty members from the US, from the UK, and then from South Africa, and of course from India, and then plus Dr. Abbas himself. This was a picture after the opening ceremony for the basic training. This was the commencement of the advanced training, and the Minister of Health, Professor Isaac Adewale, was there to open the program for us, and we can see Dr. Abbas standing right there with the minister. So Dr. Abbas, we want to thank you for the collaboration you've been doing with us for some years now. At this program, Dr. Abbas wrote a book, and so the Minister of Health presented the book to the audience on diabetes food. These were the practical sessions we had with the faculty members. Still on the practical sessions, this slide is showing 22 nurses who had wound care training, and these nurses were from 22 different healthcare facilities in the Federal Capital Territory in Abuja. Does food care education work? We carried out a study on the impact of diabetes food care education on amputation rate in the University of Abuja Teaching Hospital. It was a before and after design, and we educated these patients for about a year. And before the education, the knowledge of food care was about 31% in our patients, and after the education, after 1 year, 84% of the patients were empowered on food care. For the doctors, after the study, we found out that doctors will now check the feet of these patients where they see them more than 70%, unlike before the empowerment. In this study, we looked at management outcome of diabetic foot ulcers in the teaching hospital, and we found out very excitingly that Our amputation rate reduced over the years with education from 50% to 12.6%, which was the lowest as at this time in Nigeria. There is no trivial injury in diabetes. Beware, as little as this injury can result in gangrene and amputation of the limb or even death. A Nigerian with diabetes. Mr. PA, a 54-year-old, had type 2 diabetes for 15 years. He was a mechanic. Initially had amputation of one limb. 5 years later had amputation of the other. Thus lost his source of livelihood. Depended on goodwill only. He later died of an acute complication of diabetes. Diabetes patients feel let down by healthcare professionals for lack of early diabetes education, including food care education. So we must educate the patient, educate the patient, educate the patient. We cannot overemphasize it. Thank you.